Hello, my name is Soumya, and today I discuss about lumpy skin disease. Synonyms: LSD, needling virus disease, pseudourticaria. Classification: family Poxviridae, genus Capripox virus, and species lumpy skin disease virus (LSD) virus. Morphology: Poxviridae viruses are large-sized, double-stranded DNA organisms. Brick or oval-shaped over 100 polypeptides exist within a virion which are arranged in a core, two lateral bodies, a membrane, and an envelope. The envelope contains two layers of cellular lipids and several virus-specific polypeptides. Mature virions that are released from the cell without disruption are enveloped. Most are released by the rupture of the host cell and therefore are non-enveloped. The arranged size of Capripox viruses are 260 to 320 nm. Closely related to sheep and goat pox virus with cross immunity between the three viruses. LSD has only one serotype. Both enveloped and non-enveloped virion are infectious. History: 1929, Southern and Eastern Africa, disease of cattle, experimental infection. Oryx, giraffe and impala. Virus will replicate in sheep and goats. In 1990s, resurgence in Africa. Epidemiology: the status of lumpy skin disease in Canada is non-indigenous. First identified in Zambia in 1929, has since extended its range to all countries in sub-Saharan Africa and Madagascar. LSD became established in Egypt in 1988 and spread in Israel in 1989. Israel is the only country from which it has been eradicated through vaccination and slaughter. Pathogenesis: fever of 40 to 41.5 degrees Celsius, either transitory or lasting up to 2 weeks, swelling or nodules of 1 to 5 cm in diameter and larger in the skin, which coincide with elevated temperature, depression, anorexia, excessive salivation, oculonasal discharge, agalaxia, and emaciation. Painful nodules, especially in the skin of the muzzle, nares, back legs, scrotum, perineum, eyelids, lower ear, nasal mucosa, oral mucosa, and tail may become necrotic and deep scabs may form. Sit fast. Removal of shedding of sit fast leave a deep ulcer which slowly fills with granulation tissue. Clinical signs: incubation period is 7 days to 14 days. Warts in young cattle. Intradermal focal nodules of 1 to 8 cm in diameter. Fever, anorexia, salivation, oculonasal discharge, decreased milk yield. Vectors: most infection is through to be the result of mechanical insect transmission. Many different types of biting insects play a role, such as mosquitoes, tabanids, culicoids, biting mites, and glossina, CC fly. Diagnosis: necropsy, histopathology findings. Biopsy of lesion reveals a granulomatous reaction in the dermis and hypodermis. In the acute stage, there are intracytoplasmic eosinophilic inclusion bodies. Characteristic deep nodules are found in the skin. Nodules penetrate into the subcutaneous tissue and muscles with congestion, hemorrhage, edema, vasculitis, and necrosis. The subcut infiltrated by red watery flood. Lesions may also be found in the mucous membrane of the oral and nasal cavity, pharynx, epiglottis, and trachea, as well as the gastrointestinal tract, lungs, testicles, and urinary bladder. Lesions may coalesce in severe cases. Pleuritis, edema, and focal lobar atelectasis in the lungs may occur with enlargement of the mediastinal lymph nodes and severe cases. Enlarged superficial lymph nodes draining affected areas are common with lymphoid proliferation, edema, congestion, and hemorrhage. Synovitis and tenosynovitis may be seen with fibrin in the synovial fluid. Laboratory diagnosis, electron microscopy, indirect fluorescent antibody test, agar gel immunodiffusion, enzyme linked immunosorbent assay, ELISA, PCR, virus neutralization test, Western blot analysis. Prevention and control. Animals with the disease should be quarantined in insects must be controlled to prevent the spread of disease. Thank you.